Welcome back to Med School Mind Maps. Today I want to talk about brain bleeds, and specifically epidural hematomas. Now, what an epidural hematoma is a bleed between the dura and the skull. And to refresh your memory, the dura mater is the lining of the brain on the outside of the cerebral hemispheres here, just below the skull. And what happens is you have arteries that run in this area, specifically the middle meningeal artery in this case. So whenever you have a skull fracture, a piece of that skull bone can lacerate that middle meningeal artery, causing a bleed. And this presents very acutely because arteries have much higher pressure than veins. So that bleed can quickly progress and compress the brain, as you can see here. Now, if we go back to the epidural hematoma part of the mind map, we can look at a CT scan, and what happens is you have a biconcave lens shape. The dura is firmly attached at the suture lines here, so the bleed won't cross it. So this is how you identify it on a CT scan. And the patient usually presents with history of trauma to the side of the head, obviously, and they're going to lose consciousness very quickly, but then regain it and have very lucid periods, which last minutes to hours. And this really acutely increases intracranial pressure, so it's very important to treat this. It's a neurological or a neurosurgical emergency, and the neurosurgeon must evacuate this hematoma, which is just a bleed outside of a vessel, as soon as possible.